everyone. And I should actually say good afternoon or good morning because we have people from across the country joining us today. My name is Carla, and I am the Director of Education and Partnerships at NeedyMeds. And we're so pleased that you are all taking the time to join us for today's special topic webinar, Viral Hepatitis Education Program, presented by the American Liver Foundation. So before we kick off today's presentation, I want to go over just a few tips so you can make sure you make the most out of today's presentation. First of all, if you have any questions throughout the presentation, you can feel free to type them into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. And if we don't have the time to answer your question, we will follow up with you via email. The contact information for both NeedyMeds and the American Liver Foundation will be provided. This webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel. There are copies of the PowerPoint presentations used during this webinar in the handout section of your control panel. So with that, let's get started with what is NeedyMeds. What you are looking at on your screen is our mission statement, our vision statement, and how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And I always like to put up a screenshot of our homepage because really our website is the face of our organization. And it gives me an opportunity just to point out a few things. First of all, if you are looking for healthcare cost savings resources, you will find those under the Patient Savings tab. I mentioned that this webinar is being recorded and will be available on a YouTube channel, and you can find that on the top right of our homepage with the rest of the social media icons. It's the third one from the left. And to see what other webinars are coming up and to register, please check out our calendar of events on the bottom right-hand side of our homepage. So let's move on to today's webinar, Viral Hepatitis Education Program, presented by Paul Bolter from the American Liver Foundation. So first, let me just tell you a bit about the American Liver Foundation. Their mission is to facilitate, advocate, and promote education, support, and research for the prevention, treatment, and cure of liver disease. So let me tell you a little bit about Paul. Paul is the Community Outreach and Education Manager at the American Liver Foundation, Greater New York Division. Paul is a certified alcohol and drug counselor with 20 years of experience in the HIV, hepatitis C, and viral hepatitis fields. Through his role at the American Liver Foundation, Paul delivers educational programs focused on viral hepatitis, hepatitis C, HIV co-infection, and other forms of liver disease. His presentations have been attended by nearly 2,500 individuals. He also meets regularly with elected officials to advocate for treatment access and the implementation of testing guidelines that will ensure every citizen has access to hepatitis C screenings. Additionally, Paul is a member of several New York City advocacy groups, including the Hepatitis C Patient Navigator Network, Hepatitis C Task Force, and the Hep B Coalition. Paul works tirelessly to address barriers to education, screening, and treatment of not only hepatitis B, but liver cancer and other liver disease as well. One of his main priorities the past 2 years has been the veterans community, as well as achieving access to care in the Asian communities in New York City, where he has established partnerships with community leaders. Paul has been published in several publications about his work addressing harm reduction and viral hepatitis. Most recently, he wrote an article in International Business Weekly regarding the cost of new drugs available for hepatitis C and barriers to care. Paul graduated from the University of Massachusetts with a BA in Human Services. So with that introduction, you can see why we are so pleased to welcome him and his expertise as a guest in hosting today's webinar. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Paul. And let's see if I can do that.
Hi, Carla. Can you see my slides?
I actually can't. Just bear with me, everybody, just a moment.
Okay.
And are you logged on by any chance under a different computer or name?
I'm logged on through the internet.
Mm-hmm. So what we can do, because it doesn't look like I'm able to transfer the screen to you, and you called in and logged in via the internet as well?
Right. I can see your
Yeah.
slide. But
Okay.
you
So
have a
I'm
copy of
thinking,
mine, correct?
I do. So everybody, if you guys wouldn't mind bearing with us, don't worry, you haven't lost us. What I'm going to go ahead and do, Paul, if it works for you, I'm going to pull
Yeah.
up a copy of your presentation and I can just go through it with you, if that
All right.
works.
Thank you.
No
Sorry,
problem at
everybody.
all. And thanks everybody for your patience. But actually, while I'm pulling this up, it gives me an opportunity to remind everybody that if you do have questions, you can log them in at any time, once again, into that question section of your GoToWebinar control panel. And again, if we don't get the chance to answer your particular question, we will happily follow up with you via email. And as I said, bear with me just a moment, we will provide the contact information, of course, for both the American Liver Foundation and NeedyMeds at the end, should you want to reach out to us a little bit sooner. So thanks, everybody, for your patience while I pull up the PowerPoint slide, and we will take it from there. And don't hesitate to send in questions that you may have right now, and we'll be able to pepper Paul with all of those as they come in. So I'm just pulling up that PowerPoint. Bear with me, everybody. There we go. Okay. So hopefully I have the updated version. And let me know if you guys can see that.
Looks good.
Fantastic. And Paul, of course, just let me know when you'd like me to forward the slides, and I'll let you take it away. Thanks, everybody.
Okay. Thanks, Carla, and thanks, everybody, for your couple of minutes of patience there. I've had to move my computer to a different location, so I'm working off a different device. So anyways, it's a pleasure to always be partnering with NeedyMeds. American Liver Foundation and NeedyMeds had a great relationship over the last few years, and this is not the first time we've come together to do webinars like this, and I'm glad to see that it won't be the last. We have a couple more in the pipeline with some other of our staff, especially from our helpline. So today's topic, viral hepatitis. I like to just before I move on to the next slide, always just try to ask, go back. I always just try to ask people a little bit about what they know about the liver. And also, do they know what viral hepatitis means? You know, viral, obviously it's a virus, and the word hepatitis is obviously means, it's a Greek word, and it stands for hepa, which is the liver, and itis, which means inflammation. So when we see someone that might have arthritis, phlebitis, meningitis, it's indicating where the inflammation is. So I like to just throw that out there just for folks that may not know that, or just folks that want to be reminded. So now we're looking at the slide on what does your liver do. Your liver performs over 500 different functions. It's our body's power plant.
Apologies, everybody. Sorry to interrupt you, Paul. Turns out I'm having some computer issues myself, so hopefully, there we go. We're all caught up.
Okay, great. Okay, so it's our body's power plant. You know, it filters everything that we put into our body, whether it's something that we eat, we drink, we breathe it in. If it's absorption, it could be like a Nicoderm patch or a pain patch, or even say a Bengay or BioFreeze, any type of topical skin cream that we rub into our skin to maybe minimize some pain. That all gets processed through our liver. You know, sometimes we use many products for many years, and eventually we have a reaction to the product. And that might be a chemistry issue, and our body's saying, you know what, we've gotten along really well, but we can't work together anymore because now it's irritating your skin, or it's not working to its full potential. So sometimes we end up having to mix it up. And that's always okay too, as long as it doesn't have a lot of different crazy chemicals. The liver helps build muscles. It makes bile that digests food. There's good bile and bad bile. More about the bad later. helps stop cuts from bleeding because it helps with clotting, kills germs, and it detoxifies substances that are harmful to our bodies. A lot of people will go on a detox, a cleanse, a lot of different types of chemically induced things like that, where they're forcing their body to do something that it normally does on its own. So our liver detoxifies harmful things that are in our body. So I don't need to go to the health food store and buy some crazy detox that, I saw a commercial of, because I'm forcing my liver to do that. It's almost like taking laxatives or diuretics. Sometimes we need to initially to help our process, but if it's something that we do on a regular basis, it could cause more harm than helpfulness to us because we're forcing our bodies to do stuff, and it takes a toll. It strains on many different organs, and it's just not a healthy thing to do. And also, some of these substances could be pollution, air fresheners, certain types of fluorocarbons, things that are like sprayed, not Lysol, but like scented air fresheners. Those can be pretty dangerous for a lot of people, especially people with breathing issues. They can cause headaches and a lot of stuff. So we want to be careful about some of that stuff. And if you look at the image, the liver is located on our right-hand side. It weighs about 3 pounds, and it's about a quarter an inch or so thick, and it's flat. So it's not a big girthy organ like a heart or a lung. It's a slim, kind of like flimsy texture of an organ that's protected partially by our rib cage on the right, and it's also partially exposed. So if someone is ever having an abdominal exam and the doctor or the provider or the nurse are doing compressions and pressing down on the stomach, tapping, they're looking for density. They're looking to see if there's any inflammation. And only you can tell is if you're laying down. You can't stand up and poke yourself because you'll only feel muscle and some fat and what have you. So there's a special test, a special procedure that has to be done to feel that. And underneath is your gallbladder. And I point out the gallbladder because the gallbladder also helps with bile. But if you're someone like me who has had gallbladder attacks, it occurs when you have had like gallstones, and the gallstones start to move, and it causes inflammation in your gallbladder could burst, and the fear is that the gallstones could travel into your bile ducts. So that's not good, because then it blocks up your liver's filtering system. It kind of throws a wrench in the kink. So it's very dangerous. And if you have gallstones, sometimes you have them for many years, but because they're not doing anything, there's no need to have that type of surgery. So until they start to bother you, then they're addressed. So I just like to bring that up just because of the connection. Next slide. So these images aren't meant to scare you or shock you, but just to give you an idea, what does our liver look like? The upper left corner is a healthy liver. If you look at the color, it's pretty even, it's got some shine to it. It's like a pinkish, very smooth texture. The left-hand corner is actually the right-hand quadrant, and the smallest section on the inside is what would be closer to the center of our stomach. So it would be like on an angle. And it's about as wide as a football, but not big and fat. So it's got that nice smooth texture. If I was to touch this, if this was something that you did, what would happen was blood would just come out because it's like a sponge. The filter, it fills all the sponge. The heart pumps the blood, the liver filters it. So although they're not physically connected, they do work in the same motor for your body. So it's obviously the blood is circulating great through this liver. The result of a lab test for this will probably be unremarkable, meaning there's nothing to say. So that's great. So that's the goal of everybody. We always want everybody to have a nice, healthy liver. But then down the road, maybe you're starting to get high cholesterol, high triglycerides, some of your diabetes levels, sugar levels. Different tests that you have done may indicate, something else is going on, and especially high cholesterol. So what those tests can also suggest is that someone might be going through fatty liver disease. And fatty liver disease often looks like the second image in a sense where the scarring and the fibrosis that we see within the organ, it ends up blocking the filtration system. So a layer of fat from the fatty liver that might film over the liver will prevent the liver from functioning and processing our medicines, our food, the bile distribution. So what they did is they shaved off a piece so we can see the inside. And if you notice on the inside the white marbling, and then around some of those portals, it looks like the marbling is taken off. That's the fibrosis, which is closing the filter. So what's happening is, like I said, nothing is getting through completely. So if we take medicine 3 times a day, the first dose, great. Then we take our afternoon dose, but by the time we take our bedtime, it's not quite absorbed. So we're taking our meds like we're supposed to, but we're creating a pileup. So by the time the next morning comes, we just might be processing our days before medicine. So meaning at the end of a prescription or the next time I go to the doctor, they might notice that maybe it doesn't look like the medicine is working, or maybe it doesn't look like I'm getting the full benefits. So they may question my adherence or my compliance, but I take my meds like I'm supposed to. So that's when the cholesterol, the triglycerides, all that stuff comes in, because then that might be, okay, now we know why. So blood tests are done, and we can get to the bottom of it. So if that's the case, if it's because my cholesterol is high, it might be because I gained a little weight. It's not always related to weight, but that's the number one cause. I might, maybe my diet has changed where I'm eating a lot of fast foods, or I'm eating the wrong foods at the wrong times, and I'm not exercising. I'm very inactive. Maybe I isolate. Maybe I just don't know any better. Not everybody, is a great chef, and it's expensive to shop on the outer perimeter of the supermarket. That stuff's expensive. So I do it the best I can. So if my weight goes up, this may be a concern. But if I know that that's what the issue is, the best way to treat this is not to get medicine, but to maybe just try to modify what I'm eating. Maybe the doctor might, or the nutritionist, whoever I'm working with, might say, if you lost half of the weight you gained, so if it's 15 pounds, if you lose 7 pounds, this can be reversed. And what happens is it'll go back to looking like a healthy liver. So our journey might be healthy liver, moderately scarred fiber. We might go back and forth a little bit throughout our life, but eventually, things kind of work themselves out where, as long as we're aware of what our risks are, we can kind of monitor how far we go with certain foods. I come from a large Italian family, so food is part of a celebration. It's part of sadness. It's part of every day. So, I can't get through the day sometimes without a cannoli, but I often do, because I know if I overindulge at my age now, it's going to be harder to get the weight off, and I don't want to put myself at risk for fatty liver disease. So, and we have an issue with obesity in this country, especially childhood obesity. So we really need to pay attention to some of these things, because if we don't access care or have the ability to access care, then we may end up developing cirrhosis, which is the image on the upper right. This is not alcohol cirrhosis. This is not alcohol related. If it was, it would be a different color, and it would probably be a little bit more intact. So if you look at this image, you can see there are some black cracks through it. There's a piece of the liver where it's actually splitting away from itself. What's happening to this liver here is that there is no blood being filtered. There is no fluids being filtered to help with the liver function. There is no medication that's able to penetrate. So nothing is saving this liver. And it has a bunch of different bumps. That's the cirrhosis. And it can also be, if you look at some of the coloring, the beginning stages of liver cancer, and which, is very dangerous if you develop cirrhosis, because it just would intensify the risk factor of possibly, ending your life, or, having some other traumatic effects. When we get to cirrhosis at this point, there's really no turning back. The only option really is a liver transplant, and not a partial, but a full liver transplant. If my doctor tells me they're starting to see some signs of cirrhosis, then there might be some way to slow it down or reverse it. But when it gets to a certain degree, there's, you just go with it and try to make sure that whatever you're doing doesn't make it worse, doesn't intensify it. So here we have these three images. It's a lot to look at, especially when we're thinking about our diets and fatty liver. I mean, when I'm at events and people hear, oh, you're from the Liver Foundation, the first thing, oh, my liver last night, I drank too much. But it's not always about the liver. It's always about alcohol. It could be about over-the-counter medicine. It could be about prescription medicine, like especially steroids. People that use albuterol or other inhalers often overuse them. So that can create cirrhosis over time. The steroids are really hard on the liver. Some people need steroids. Hopefully they're getting their liver function tests monitored regularly and everybody's aware of what's happening. But also the food part, it's like when you talk to people about their weight or about their eating habits, there has to be a lot of sensitivity and there has to be a lot of mindfulness on how the message is delivered. I can joke about my weight and my eating habits about myself because, it's always a struggle, but we try to be careful when we're talking to an audience or a patient or even a coworker or a family member that, how are we going to address the fact that we notice a rapid weight gain or a weight gain over a certain amount of time? Because, we don't want to offend anybody, we don't want to be inappropriate, and it has to come from a place of love and care, otherwise the message might get lost. So on our next slide, I try to just, talking about how I eat, sometimes I talk about, like, this morning I went to Dunkin' Donuts and I got a donut and a coffee, but then for lunch, I'm going out for pizza and some garlic knots, but I'm going to have a diet soda because, I'm trying to be healthy. So sometimes when we look at our portion control or what it is that we're eating, and then if we say, but I had a diet soda or a juice, it doesn't make it okay because we know diet soda and juice has a lot of sugar, soda has a lot of complications. So, but I want to eat all this delicious food and, I don't want to save any for later. Well, it's about portion control. This portion is probably something that I would attempt in one sitting, but I know it's not very healthy. So whether I drink a Diet Coke or not, it's not gonna help me. So I just try to think about like how much we're eating at a sitting, and what are we washing it down with? If you want to drink soda, how much soda are we drinking? I'm eating a lot of fried food. How much is a real appropriate serving of all this fried deliciousness? Because it's good and I want to enjoy it. I don't want to live like I can't have it. I want people to enjoy their lives and enjoy your food, enjoy your culture, but just think about how much, when, and what's the circumstance. So the next slide. So talking about causes of liver disease, it's caused by many things: viruses, genetics, could be mother to child, autoimmune disease, which is very difficult in testing sometimes and diagnosing, excessive alcohol use, poor diet or obesity, reactions to medications, street drugs, and other chemicals. There's over 100 different types of liver diseases out there. Some of them don't even have names yet. Next slide. Can you hear me? Oh, there you go. So what is viral hepatitis? Like I mentioned earlier, it's inflammation of the liver. It's caused by a virus. There are many types of hepatitis C, A, B, C, and D. I'm sorry, I'm having electrical trouble here. Okay. I'm sorry. So many different types of hepatitis A, B, and C, and D are very common, but in this country, hepatitis A, B, and C are the most common. We are seeing some hepatitis D out there, but not enough to really get into. But I imagine in the next year or so, there'll probably be more conversations about that. But hepatitis A, B, and C are the most common and prevalent that we have in this country. Next slide. So our ABCs. So really briefly, hepatitis A is spread through food or water that's been contaminated by fecal matter. Many cities around the country and around the world have signs in the bathrooms that say employees must wash their hands before returning to work. Those signs are a result of hepatitis A outbreaks and epidemics around the world, because if somebody prepares some food and if they've come into contact with anything that's been contaminated by fecal matter, it could be spread to food or person to person. It usually hits the person around 3 to 6 weeks. It's kind of hot and heavy, and there's a lot of jaundice, a lot of diarrhea, dark color urine, and a lot of fatigue. So people may take a nap, but they're not rested. It's not a restful nap. It's a nap because they're anemic and they just need some sleep. But fortunately, there is a vaccine. So that's one side of it. Hepatitis B is spread through blood and body fluids such as semen, vaginal fluid, and saliva. So it's great that there's a vaccine for hepatitis B as well. So I'm vaccinated for both hepatitis A and B. But if I look at how hepatitis B is spread, semen, vaginal fluid, and saliva, just because I have the vaccines against A and B doesn't mean I have vaccines against any other STD or tract infection, anything else that may live in semen, vaginal fluid, or saliva. Doesn't protect me against HIV, unwanted pregnancy. I just got to be really mindful that although I'm vaccinated for A and B, that's it. It's 5 to 10% of adults will develop a chronic infection, which could lead to liver damage. So there's acute and chronic. Acute is like at the beginning when the diagnosis, maybe the first sign, a symptom. Chronic is ongoing. If someone coughs every day, they have a chronic cough. It's an ongoing cough. So chronic infection is something that lives with us and just travels with us wherever we go. And sometimes it's really hard to shake. So hepatitis C is direct blood-to-blood contact. So hepatitis A and B, there are some specifics, but the number one specific route of transmission of hepatitis C is direct blood-to-blood contact. Not yet with the jaundice.
Apologies.
That's okay. You're blowing my surprise.
Sorry, everybody. I think still technical difficulty on my end as well, so I apologize. Let's see if I can go back. There we go. Thanks.
Okay. All right. So most people that have been infected with the antibody do develop a chronic infection, and left untreated could cause liver damage. There's no vaccine. There's no prophylaxis. The only thing you can do is just not share any items that have had anybody else's or a contaminated blood source. Now, sometimes, people like, well, I don't want to get too far ahead of myself, but some people might use a toothbrush or a razor or a straw of somebody's, or if somebody's smoking out of a pipe or a hookah, and if you're sharing it and anybody has any blood in their saliva or on their lips or anything like that, or if it's on the toothbrush from bleeding gums, nail clippers, anything that might be some blood exposure, that's very high risk because the virus will live on that item for a number of days, and we just don't ever want to get in the practice of sharing those types of personal things. They're cheap enough that we can replace if we think somebody used it, so always err to caution and don't share those types of things with folks. And as a symptom of having hepatitis, someone says, how do I know if I have it? Will I show any symptoms? One of the symptoms might be jaundice. And if you notice these images, there are two different people. One is a little more light-skinned than the other. And the reason why I show these is because when you look at yourself in the mirror, you're like, do I have jaundice? You can't see it. You can't see the yellow that is visible to somebody else because it could be a lighting issue. If you're under fluorescent lightings, like me, you look bad all the time. Fluorescent lightings are not my friend. So, I like to depend on daylight, sunlight, and things like natural light. But, if you go into a doctor's office, the doctor might see that you do have some jaundice, and then the follow-up questions would be, how are you sleeping? How do you feel? Do you have any nausea? Do you have any fever? A headache? Diarrhea? Anything? Because maybe this is the first sign that we might have to have the conversation about hepatitis. So on the left, to our left, is a little bit of yellowing in the corner of the eye. But on the right, you can see there's a lot more yellowing, and also there's yellowing of the skin. So for certain folks, it might be more obvious in the whites of their eyes, or it might be equally as obvious on their skin around the eye. The darker we are, the more obvious, or the more brighter the yellow jaundice may appear. It might not be like, yellow like a blinking light, but it could be yellow enough to be noticeable. So it's just very different from case to case. But that is one of the physical signs. I just want to point this out. The liver doesn't have any nerve endings, so it doesn't emanate any pain. So I don't walk around saying, oh, my liver hurts today. I might be able to say, I'm having pain in my kidneys, or I'm pain in my heart, pain in my chest. I can go to where the pain is. But because the liver doesn't tell me that, this may be how it's speaking to me. It might be saying, hey, jaundice, or, the fatigue, or the other things. So just be mindful of that, you don't wake up in the morning saying, you know what, I think I have hepatitis or liver disease. Next slide. So Hep C, we talked about this earlier, is a liver disease caused by a virus, blood-to-blood transmission. Hepatitis C could cause cirrhosis, which is scarring, liver cancer, or liver failure. Liver cancer and liver failure are, of course, the end stages, but left untreated, any liver disease could cause either one of those. And like I said, most people might not have any symptoms for many years before being diagnosed. If someone was diagnosed today, chances are they very well, depending on their age, could have got it 20 years ago. If they're a baby boomer age and they're being diagnosed today, that's between 1945 and 1965. If they're a Korean War vet, certain risk categories, you can kind of go back to where maybe it happened, but you just don't know sometimes because it could take so long to show. And it has to be a specific test. When we go to the doctor and the doctor takes a couple of tubes of blood, they're not testing for anything but maybe sugar and a few this and that. They're not really looking for anything specific. The more tubes of blood that they take, it's obvious that they're testing for more things. And each test has to be a specific tube of blood. Currently, Hep C is reaching probably 3.6, 3.7 million people in the United States. Depends on where you get your resources, where you get your information from. And that's how many people in the United States that are infected. It's not Americans. So I want to be clear that this country is made up of a lot of different people from all over the world, not just American-born citizens. So there are a lot of different things that are going on out there that we aren't able to approach because some folks may not have access to care. They may not, for immigration status, whatever the reason is. So there are people that may be living with this disease that don't even know they have it. So the numbers could be actually a lot more than this 3.5 that it shows here. Next slide. So who should be tested? Should I be tested? I'd say, if I did any of these things, if I've ever used needles or other equipment to inject drugs, even one time. Not every person that injects drugs carries hepatitis C, just to make that clear. But if I am somebody that is injecting drugs with somebody else, and I have a lot of my own equipment that I don't need to borrow any of theirs, but I might borrow some of their water. Okay, that's not a good idea. That's a potential risk factor. So I want to try to make sure I have everything of my own that I don't need to share with anybody else. And also, if I have access to needle exchange, that also prevents me from getting other infections because I'm using clean needles. I'm not using the same one over and over. There's no bacteria growing. I can't give myself Hep C in this state, but I want to make sure that I don't get any bacteria infection or anything else. I mentioned the baby boomers a minute ago. If I'm HIV positive, I may have gotten HIV from a blood transfusion, IV drug use, dialysis. surgical procedure, something might have happened with a contaminated implement. For a lot of people on this call, this is pretty significant. If I'm a healthcare worker or emergency medical worker exposed to needle sticks or blood, if I walked across a puddle of blood on the floor, naturally it's not going to be a risk. But if I had an open wound in my foot and I walked through it, that's a risk. If I am drawing blood or giving somebody a vaccine, or if I'm doing a finger stick and something happens where I end up sticking myself after I've already stuck the patient, then that's a risk. So then I would need to get screened. And even that first initial screening isn't going to tell me anything. It's going to have to be the next time I get tested, because you have to build your first levels of labs first before you can find out. So I'm always careful about how needles and syringes are carried to an exam room or how they're placed on a tray. Nothing should be uncapped. When things are finished and you're done using it, it should be capped again. And when someone is cleaning up, they should be wearing gloves. They should never just scoop things up and dump it in the trash. Things need to be separated from the tray. Needles need to go in a sharps container. Anything with blood on it needs to go in a sharps container, and the rest of the stuff can go in a hazard waste. But it's really important that if you're in this field, you do not get stuck, because the first question will be, well, what happened? What did you do? And it's our responsibility as the professional to have the situation in control. Some things are beyond our control. But if we're having a patient that struggles or that just isn't helping us get this done, call in for backup. Call your supervisor in, or call in for a coworker with different experience, because it might take two of us to just help this person calm down or feel more comfortable, so that we can either give the injection, or take blood, whatever it is we're doing. So always err to caution and take your time. If I received a blood products or organ transplant before 1992, if I have abnormal liver enzymes, as I mentioned earlier, around the whole fatty liver and diagnosing liver stuff, that my liver functioning tests and everything could be a little wacky. And for some people, it's always that way. But if it's really elevated and really a little abnormal, then we should probably do more testing. Doesn't always mean we have Hep C, but it could mean something else is going on. If I've ever been on dialysis, and if I was born to a hepatitis C infected mother. Now, this is a touchy subject, this last bullet. When you ask people, what do you think the risk factor is for a mom to pass on hepatitis C to her baby? You think about that for a minute. People might say 50%, might say 95%, or 100%, or they might say there's not a risk at all. And I think because we hear so much about HIV transmission and stuff like that that's happened throughout history, we tend to maybe always think the highest, or just because we don't know, because people haven't made that clear about Hep C. But it's less than a 5% chance that a mother will give it to her unborn child. And a lot of factors. What is the mom's viral load? Is the mom on any type of treatment for anything? The baby can't treat the mom for the Hep C with some of the medications that can cause birth defects. So there's a lot of factors that have to be taken in. And if the mom's viral load is really, really low, the chances go up that the baby's not going to be born with Hep C. So there's a lot of things that happen, but most of the cases that have been proven and documented, it's been less than 5%. Next slide. So should I get tested? Maybe if I've shared straws to snort cocaine or other drugs. When we stick straws in our nose or dollar bills rolled up, if we're snorting a drug, they're abrasive. So they kind of rip apart our nasal passage there and causes a lot of sniffing and mucous membrane to be exposed. And if that straw or whatever it is gets wet from our nose and we share it, that's a good way of passing it on. We want to be very careful about that. Having tattoos or body piercings, well, this depends on where and who does your body piercing and tattoo. If you're doing it in someone's house because we're having a party, Carla and I are going to have a tattoo party, and I told her if she brings 5 people, I'll give her a free tattoo. chances are by the time I get to Carla to give her a tattoo, I may reuse somebody else's ink because maybe there's a certain shade of blue she wants, and I've already used it 3 people ago, but I have a little bit left. So chances are that's how a lot of it happens. So it's probably not a good idea I go to her house for a tattoo party and maybe to come to a licensed, salon where, you go in, you do a visit, you have a consultation, you look around. Tattoo parlors and stuff like that aren't the most beautiful places, so don't expect rugs and crystal. But, look around, look at how the people are preparing. Look and see if they're using disposable equipment. Look to see if they use disposable cups. There are a lot of things to look out for while you're there for your consultation. So this is before you even have your tattoo. I videotaped the person that gave my tattoo when he was preparing for me, and he didn't know it, but I shared it with him later because I thought he went above and beyond. And tattoo artists and body piercers are very well aware of HIV, but they're very well aware of how infectious Hep C is, and they're more concerned about hepatitis C than they are of HIV. And I also mentioned this earlier about personal care items, razors, toothbrushes that may have blood on it. Remember this, because I'm going to come back to this one statement, this one bullet later on, when I mentioned something about can we give ourselves Hep C? And I want you all out there to think about that. Can we give ourselves Hep C? And I will answer that question later on. Next slide. Hep C is not spread by casual contact, hugging, sneezing, coughing, sharing utensils. In the early days of Hep C, there was concern about breastfeeding only because if the baby was an aggressive eater, maybe teething, and if the mom was a little dry or cracked around the area, but it's not found in breast milk, so there was no risk of Hep C ever reported being transmitted through breastfeeding. So it's not a problem. Next slide. So how do I find out I have hepatitis C? Well, just like HIV, here's where some things are very similar. So like HIV, Hep C has an antibody test, which indicates if I have the antibodies. So this means it could be a finger stick where it'll say, Paul, looks like you're positive for hepatitis C because somewhere you were exposed to the antibody. I won't know how much or anything more until I have the confirmatory test, which we refer to also as the viral load test. This confirms whether there's real active virus in my system. So that's also going to say how high or high-low my viral load is. So if I have a really high viral load, chances are maybe I have chronic infection and I didn't know. If it's really low, maybe it's not so bad. Maybe it could be cleared, because sometimes our body will clear the virus on its own depending on how low the viral load is. It doesn't happen all the time, but it does happen. So if in fact it's confirmed that I do have hepatitis C, what do I do next? Well, we're going to find out what's my genotype, what strain, what type of Hep C do I have. There are 4 different genotypes, 1, 2, 3, and 4, that are out there, and not everybody has the same type of Hep C. Not everybody got Hep C the same way. So it's not everybody with Hep C is going to fit into the same category, but the common bond is that the Hep C virus. Next. So if a person has hepatitis C, before we even get into treatment, we have to find out, do they have anything else going on? Are they on the borderline of cirrhosis? Do they have any liver cancer, any other scarring or fibrosis going on that we need to be aware of? Because we want to get them treated as soon as they're diagnosed. There's no sense of waiting until the person develops severe disease. It's always good. You're diagnosed, let's get you on treatment, let's get this taken care of. So with that, they also want to find out what genotype do I have? What's my pre-existing conditions? So a pre-existing condition could be asthma, arthritis, mental health issues, anger issues, eating, depression, suicide ideation, any number of things. And that's because of a fear of side effects, how they may handle it. But today, those fears are a lot less because the side effects are better. And then do I have any prior treatment history, meaning am I treatment experienced? Have I ever been treated for my Hep C before? If I have never been treated, then I'd be called treatment naive. But if I've been already treated once in the past, I am now treatment experienced. That's going to determine what medications I can take, or if there are medications I can take. I might have gone through everything out there and nothing's worked. So those things have to happen beforehand. And from there, the health provider will talk with you and the patient on what's the best course. If none of these drugs are available, or if there's another issue, clinical trial are always available. They're very safe, they're monitored, and there's several people that work with the patient while they're on a clinical trial, so the patient's never alone during that brief journey. They're usually not extended very long time, and they're very safe because it's one more step before it gets its name and stuff like that. Next slide. So some other things to consider are that the new oral medications have either no side effects or very few side effects. Some of them might be fatigue, headache, rash, anemia. These are mostly found with the old standard of injection treatment that is no longer really preferred. Also, those treatments deterred patients from getting into care because they didn't want to have to do what was expected of them, either a self-injection or deal with certain cases of anemia and stuff like that. So fortunately, we have new medications out there that have little to no side effects, maybe even just a slight headache. I know several people that have been on the new treatments that have traveled all over the world, swam in Olympic swim teams while they were on medication. It never impacted their life. The only thing that they all had to be concerned with was taking it every day like clockwork, because you cannot skip a day while you're on treatment. Next slide. So as we wrap up, I just want to talk about success. So the goal of HIV is to have an undetectable viral load. If I'm undetectable, I'm untransmittable. If I have hepatitis C, the goal is to have a sustained virological response, an SVR. This means that the virus can no longer be detected in the body 3 months, 12 weeks after the medication has been completed. This occurs, the virus is gone unless the patient becomes reinfected. So some of the treatment, 8, 10, 12 weeks, so the SVR would determine on the length of the person's treatment. This was originally written when there was 12 weeks, but now there are other treatment regimens out there that are a little shorter. So each treatment regimen has its own determinant of when the SVR comes into play. So now I asked everybody earlier to think about that question about giving themselves hepatitis C. So the short end of the question is no, because we can't create this bacteria that we give to ourselves, like a virus or a blood disease. What happens is how we can transmit it to ourselves, and this is the only way, is if I get reinfected by using my razor blade, old toothbrushes, nail clippers, anything that came in contact with my infected blood prior to treatment. So on my last day of treatment, the doctors will say, okay, Paul, it looks like you've cleared the virus. We want you to go home and throw away all of those personal care items. And I might say, why? And they say, well, because now we know you don't have the virus in your system, but if you reused any of that old contaminated stuff, there's high risk of you reinfecting yourself with hepatitis C. So this also means that I may not be able to go on another treatment. Maybe my insurance won't pay for it again twice in 1 year. Maybe I didn't do well on the treatment and it caused other issues. So there's a lot of things that happen. And I don't want to get a disease that I just got rid of that has the potential, risk of, causing me to lose my life or anything else. So we want to be very careful. So just be mindful of that. A lot of people aren't told that. They tell me that, oh, no one ever told me to get rid of my razor blade. Well, I'm telling you all now to get rid of your razor blades, your toothbrushes, nail clippers, all that stuff. It's affordable enough that you can replace it. So on to the success of treatment. So the cure can vary by each genotype and degree of liver damage, of course. So if my genotype is 1, my cure rate is 85 to 99%. Now, the old standard might be 45 to 65, so it's nearly doubled here. If I have genotypes 2 and 3, or 3, the success rate is even higher at 95, 99%, and if I have genotype 4, it's up to 100% cure rate. So for a while, there was only one medication for one genotype, one medication for another. So if I didn't have either one of those genotypes, I couldn't be treated. Now there are medications that cover all genotypes. So you never have to fear, oh, I don't have that genotype. Certain commercials we'll see for medications, but it's only for one group of people. So anybody that's thinking about treatment, ask the provider first what might be best for you and not what you see on television or in an ad, because that might be for somebody completely different. So there are medicines for everybody with Hep C. And if I have HIV co-infection, then I might have to go on maybe a little longer bit of treatment, maybe from 3 months to 6 months. But there isn't usually a lot else that has to happen. Maybe the HIV meds might have to get adjusted, but that's per individual. Next slide. So healthy living with Hep C. So, this is either someone that has Hep C or someone that has cured Hep C, somebody that might be at risk. The suggestion is try to see a healthcare provider regularly. Now, of course, that could be your general medical doctor just because you have contact, but also try to see a gastroenterologist, hepatologist, or infectious disease doctor that specializes in hepatitis C and viruses, like HIV as well. Always try to get other health screenings if you can. Also check to see if you've been risk of liver cancer or any other Hep C complications. If you're not vaccinated for A and B, or if you don't remember, you can ask your doctor to start the vaccination process, but they'll also test you to see if you have the antibodies in your body already, and if you do, they won't go through with the rest of it. It won't hurt you anyways. And if you want a booster, the booster is only one more injection of what you've already got. It's nothing special. So if it's 20 years ago and you want to get a booster shot, your doctor thinks it's very simple, it's nothing crazy, fancy, it's not expensive, it's just the booster sounds like it's bigger than it is. Try to follow a healthy diet. That means something different to every one of us. Not all of us eat the same, not all of us live the same. So whatever you're doing, just think about, how is this affecting me? If you're someone in your teens and 20s and you're like, oh, I don't have to worry about this until I'm 30, well, think twice, because it may happen. Something might happen to you sooner. And try to attempt to address substance abuse issues. Abstinence is not for everybody. This 12-step programs work for those who work it. Harm reduction is always a great way of talking to somebody about their substance abuse or about their drinking and drugs, and just figure out what's going on, how it affects their lives, because it may impact whether or not they have access to treatment in certain settings. So it's always good to have an idea. What are we doing? How are we eating? What's our lifestyle like? If I'm going to go on treatment, I want to cure this virus the first time around. I don't want any of these risk factors to interrupt that. And that is it. So that's our final slide on this. Oh, but before we go, I'm glad I forgot I had this here. Some people are used to liver biopsies as what's going to tell them, yes, this is how much disease you have, or this is, how much scarring is that. But now, in the last few years, there's been a new technique called FibroScan, which what it does is that button in the middle of my hand on that device will send off magnetic vibrations to your liver, and then it sends a message back to your liver to say how swollen or inflamed, how dense. It tells the device back what damage or what shape the liver is in. And this takes about 10, 20, 30 minutes tops. It's non-invasive. You don't have to have any needle or pain medicine. You lift up your shirt, they put some jelly on you, and They click, 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 and they get the results immediately. So not everybody has this because they're pretty expensive, but there is an alternative to liver biopsy, but it always is going to depend on the treating provider on what route they want to go down. So, and that is it.
Paul, thank you so much for that thorough and entertaining and extremely informative presentation. And I will remind our audience, if you have any questions, you can go ahead and type them into that question section of your GoToWebinar control panel. And I see you all remember that because the questions are coming in, which is great. And before I get to everybody's question, I have a question. Paul, could you repeat the name of that device you just showed us and introduced us all to?
FibroScan.
FibroScan. Okay.
Yeah. And
great.
they're like, yeah.
Thank you very much. And before we get to those questions from Paul, I do want to remind everybody that in addition to the American Liver Foundation, which you saw from this presentation, is a great source of information and support. We do hope you remember that NeedyMeds is here as a a source of support as well. What you're looking at on your screen are our most popular and cost-effective ways to save on your healthcare expenses. And if you'd like to check those out further, again, you can visit that patient savings tab on the NeedyMeds website, or you can join us for an overview webinar. Speaking of webinars, there are upcoming webinars, which we do hope you join us for, and the next overview webinar, so you can learn more about the resources we have, is scheduled for Monday, August 19th. And you can read more about what these webinars cover and register for those by checking out, again, that calendar of events on the bottom right-hand of the NeedyMeds homepage. Paul also mentioned a little bit ago during his presentation that the American Liver Foundation and NeedyMeds have partnered in the past, and we are continuing to partner in the future with further webinars. We hope you check out our calendar of events to see other American Liver Foundations on our calendar. But I did also point out our YouTube channel, and if you do want to go back and watch previously recorded American Liver Foundation presentations, please do check out the ones we have on our YouTube channel. Now, as we answer the questions, I wanted to leave the contact information for the American Liver Foundation and NeedyMeds on the screen. So, Paul, we do have a bunch of questions coming in. The first one is, what are your thoughts on milk thistle?
Okay, well, I'm not a medical provider, so I can't tell anybody what to do, but what I would suggest you do is before you take anything over the counter, especially herbs, you ask your provider, is this a good idea for me or not? One of the things I mentioned about causes of liver disease could be over-the-counter medicine, especially vitamins, because they're not FDA approved. Many people take herbs and vitamins or supplements because they think they need them, but they might not really need them. So if I'm taking something I don't need, why should I take it? Milk thistle has always been tossed around since Hep C came to the world space, but it's not something that any doctor in the United States that I know of has ever prescribed or suggested. So ask first.
Thank you, and thank you for the question. Another question coming in is Hep C considered an STD?
Well, the risk of Hep C, contracting Hep C sexually is very low. So, for that, it might be. But, most people that are diagnosed with Hep C aren't getting it from sex. There has to be 2 pools of blood. So think about the act. Think about, is there blood? Are there condom use? What are we doing? What kind of sex are we having? Traumatic sex, this and that. Just look, if there's 2 pools of blood or a potential for 2 pools of blood, then yeah. So.
That's a great question. Another question coming in is, if I want to make sure my liver is healthy, what tests should I ask my doctor for?
Great question. And sometimes the doctors don't know until we ask them for this. We can ask for a liver function test or a hepatitis panel test, a Hep panel. They're not very expensive, but they're not the first thing a doctor might think of unless we give them some indicators. Like I said, if my weight changes from the last time I saw my doctor and they look at my records, they're going to start to ask me some questions. Or if the nurse, I'm really close with the nurse, she may notice these things as well. So, I would ask for, ALT, a liver function test, liver panel, stuff like that. A very simple test.
Great. Another question coming in is, on the website or in general, is there an American Liver Foundation recommended healthy liver diet?
No. Like I said, we're not a medical institution, so we don't have like our versions. What we do is we will highlight NeedyMeds. NeedyMeds has great resources for such and such. We do have information on our website that you can look for on fatty liver and eating healthy, but it's very simple. It's maybe take a look at the food pyramid, how much size control portions you should be eating, and stuff like that. But no, we don't have anybody on staff to say you should be eating this way, or that way.
Great. And I think the next question coming in will have a similar answer, but I will ask it, which is the person comments that they do see a lot of advertisements for drugs that cure hepatitis C. And I was glad, for myself personally, Paul, I was really glad that you broke down that there's 4 different types of Hep C and there's different drugs for each of those. I wasn't aware of that at all. So the question that this person is asking is there a recommended American Liver Foundation drug?
No. The American Liver Foundation doesn't have drugs. The American Liver Foundation doesn't endorse or recommend any drugs. That's not our role. Our role is to bring resources together so that we raise awareness and educate folks on liver disease. So if somebody called me and said, I was on the latest drug and it didn't work, what should I do now? I'd say, well, go back to your treating provider and ask him what your other options are, because there are other drugs on the market. I can tell you what the names are, but I can't tell you that it's going to be right for you. So say if I have one genotype and I take that genotype specific drug, well, I know there's a drug that covers all genotypes, so I don't have to be pigeonholed into just that one medicine. If that one medicine doesn't work, there is another one out there that might. So just keep that in mind. We don't have nurses or doctors on staff that make recommendations. We just share the resources that we have.
And I think it's a great thank you for asking that question, because as Paul made so clear, it's a great opportunity to clarify what the role of the American Liver Foundation is. And as you can see, they have a breadth of resources. But at the end of the day, as Paul mentioned, you're always going to want to correct your own personal provider.
Right. A lot of times, some patients of a certain age or a certain culture, language barrier, it may not be easy to ask certain questions. So I often, if someone calls me and they say, what kind of test should I ask for? I'll say, well, you're at the doctor, write this down. I make sure they write it down. ALT. I have them spell it out. So that way when they go into the doctor's office, they're armed with the information that they need. So if the doctor or the appointment is going a little fast, wait a minute, I have questions, and ask your questions. So sometimes people get flustered. Doctors or nurses or people in a white lab coat look like they're authority figures, but patients are very smart, very savvy, and can often teach our providers things about us. So always remember that it's your appointment and come prepared.
That's also really good advice in general for anything else you're struggling with, which is to advocate for yourself, and great advice to make sure you write down those questions, because I'm guilty of that just like everybody is. I walk into the doctor's office and I'm very flustered within moments. So having going in there with a pad and a paper, a pad of paper and a pen, having questions already written down, I think is advice that we can take to any health issue that we're dealing with. So I don't see, I think we've gotten to most of the questions. There may be a few others that we didn't get the chance to answer. And if that's the case, again, you can reach out to the American Liver Foundation, or of course, we will follow up with you via email. I want to thank our audience for taking time out of the day to join today's webinar. We encourage you to check out our future calendar events to see when the American Liver Foundation will be presenting again. And do visit or subscribe to the NeedyMeds YouTube channel and check out some of those previously recorded American Liver Foundation presentations. They absolutely are worth your time. And a big thank you to Paul for sticking in there with, even through those technical difficulties, to share his breadth of experience and expertise with the NeedyMeds audience. We deeply appreciate it. So everybody, enjoy the rest of your day and do stay in touch. Thanks, Paul.
Thank you.